Well, welcome back, everybody, to episode 4 of our little video podcast series here. A New Hope for Opiate Addiction.
Yeah.
Yeah.
Another side of a draconia.
Another side of the draconia. So today we're going to be discussing my favorite subject here is our clinical services.
That's absolutely right, Michael. Today we wanted to take the opportunity to walk our viewers through the clinical program here at CMAR. In future episodes, we'll definitely get in deep with some of the specific interventions, the service providers, all that stuff. But today we really wanted to share a 1,000-foot view of what the clinical services look like. Maybe 10,000 foot, who knows? Michael.
Yes, Cortland.
Would you do us the favor of walking us through the initial phase for all patients, whether they're taking an IOP or OP?
I thought you would never ask. For all of our new patients, it begins with an initial screen on the phone with one of our clinical assessment representatives. This is just to make sure that anyone coming in our doors is a good fit, that their needs for us to get a general sense of what their needs are like, and for us to figure out what level of care that they need. Our admissions representatives are excellent, and we can certainly help pair people with other treatment programs or options if we're not the right fit. So from there, clinically, we'll do a clinical assessment, a biopsychosocial assessment, as well as any other clinical testing that we need to do. We have a psychologist that we can utilize for testing as needed. And then we will get them ready to begin our services.
Wow.
Pretty interesting, right?
That sounds extremely, like some extremely in-depth services there.
Yes.
Yeah. So typically opioid-specific providers only focus on the addiction piece, mm-hmm. right? So they're, and even then, they're just assessing whether or not the person, generally speaking, they're assessing if the person has opiate addiction by looking at a urinalysis outcome, looking at a panel.
Sure.
So what you're describing, the process you're describing runs parallel to the medical services we offer, right? So yes, we are doing that clinical piece, but simultaneously we are doing what other medical-oriented opioid-specific providers are also doing.
Yeah, so we have a medical and a clinical intake and assessment process.
Okay.
So the same thing that you would get if you're getting Suboxone from a physician's office or even Methadone clinic, of that, they get a physical exam, a physical workup. We can do blood testing, blood labs, make sure that all of their organs and their systems are working the way that they should be. Mm-hmm. And as well as that, they'll also do a full clinical intake and assessment, including that biopsychosocial I mentioned, as well as a full case management assessment to see how we can support them and their lives, their families outside of the clinical rooms.
It's incredible stuff. So if a patient is withdrawing and going on to, say, Vivitrol, for example,
yes,
or Suboxone, they could theoretically do an induction, clinical, medical case management sessions, or intake sessions. They could do all of that on the same day, or at the very least, all of that is being provided in one single location for them, whether they're in person or remote. Obviously, for this phase, we would prefer them in person. Is that accurate?
Yeah, absolutely. We can act as somebody's doctor's office, their therapy office, and even for those that need it, we can act as their pharmacy to make sure that they're getting the medications that they need on time and that they're taking it as they're supposed to be.
Wow. Incredible. Again, incredible. That's going to be my refrain for today. So, Michael, does this mean that if a patient is on a daily dose regimen, that they can come in just once that day, mm-hmm. get their meds, do, let's say, an individual service, individual therapy, family therapy, case management, whatever it is, and attend group all just one after the other?
Yeah, absolutely. We're very much designed to be as efficient as possible in our service delivery. Most of our clinical services, our groups are held after work in the evenings from 6 to 9. We want to make it so that way our clients can still, maintain their daily schedule and routine that's good for recovery. Things like work, family time, etc. So when a client comes in the office, we try to be as efficient as possible to do things like their individual counseling, their family therapy, their case management, their medication management, their group therapy. We can do a lot of that in the same time, the same days to minimize their need to come to our office, as well as the ability to provide quite a few of our services via telehealth. We also have an option to provide all of our services via telehealth, but right now we're using kind of a conjoint program of in-person and telehealth to make things as convenient as possible.
Wow, it's a veritable one-stop shop.
A veritable one-stop shop.
So, of course, as many of us know, an IOP group, for us, it's 6 to 9 p.m., but that's that 3 hour period, 3 days a week at our program. They're also getting at least one individual. They're seeing a licensed and waived medical provider. They're seeing our case manager. They're they're getting a whole host of services. Now, if somebody's in outpatient strictly, how does that differ? And I know that there's a pretty wide range of how that can look.
Yeah.
So what would that look like, say, if I'm coming right in on OP versus if, let's say, I have 6 months clean either in the program or coming into the program, but I have a much more foundational experience underneath me. What would those two pieces look like?
Yeah, absolutely. So as you mentioned, the IOP is 3 groups a week, 3 hours per group, about 9 hours group therapy, plus the individual case management, medical component, and family therapy. The outpatient program is very similar, but we usually start at 2 groups a week for an hour and a half, but they'll get the same ancillary services, the individual counseling, the family counseling, the medication management, and certainly the case management services. And as people progress in their recovery, we can drop down those services to 1 group a week or 2 groups a month. And the individual counseling is always available for our patients who want it and need it, and certainly that case management piece to support them in all the activities of their life outside of their therapeutic needs is very important.
So really, coming to CMAR, someone can, let's say, go through they go to a detox center that provides a residential treatment component. Let's say they don't come right to us. They go to partial hospitalization, a more intensive IOP 5-day, then come over to us. They can, and I'm really asking this because with medications like Suboxone, it's obviously hugely important to extend the access of care to parallel the continued use of Suboxone.
Sure.
For folks that have a longer term taper or are in a medically or psychiatrically complex circumstance where they need to be on maintenance. For those folks, can that entire sort of latter phase last 12 months or more, or get people to that 1 year mark where if they do remain on maintenance, they've gotten a full year of wraparound support?
Absolutely. Generally our IOP, our intensive outpatient program, is at least 3 months. And then our outpatient services can be tailored for whatever a person's individual needs are. But as long as someone is staying on maintenance medication with us, they're going to maintain some sort of clinical involvement, and that can last as long as the individual needs. And certainly 12 months or longer is not out of the question for a lot of individuals.
So the access to support, that would be true for an abstinence-driven patient of ours that's looking to just, let's say, be on Vivitrol or naltrexone, a MAT patient that's doing an extended taper or titration, as well as a maintenance patient, or would it just be for like a maintenance patient?
No, our services and the length of our services are available to anyone, regardless of what medications that they're on.
Wow, that is
Pretty cool.
that's pretty rad. What? Okay. Uh, So amazing stuff.
Absolutely.
So,
Thank you for asking such thoughtful questions today, Cortland. I think in our future episodes, we're going to bring in some guests to talk a little bit more broadly about MAT and opioid recovery in our community,
yeah,
as
that's gonna be
well
really
as
exciting.
go into more depth about different parts of our program.
Yeah, yeah, we really look forward to it. All right. Well, thank you so much, Michael. I really appreciate your time today. Sorry, a bit of a case of the giggles. Hopefully, everybody still got what they needed out of today's little educational video.
Absolutely. Thanks for joining episode 4, A New Hope for Opiate Addiction.